Population health studies rely on an averaging assumption. With large enough patient cohorts, aggregate risk estimates converge to the true population incidence. This is a statement about the cohort, not about any individual patient's trajectory. Population statistics can be perfectly valid on average. They do not protect the individual patient. The distinction between cohort and patient trajectory is structural. Cohort statistics aggregate outcomes across many patients at a fixed follow-up time. Patient statistics trace a single individual forward through their disease course. The law of large numbers operates in the cohort. The patient lives on their own path. A single catastrophic clinical event along one patient's trajectory does not disappear in the cohort average. If one case dominates in severity, the population estimate can still converge, but that individual patient has already experienced irreversible deterioration. The cohort statistics are intact. The patient's path is not. Some clinical states are absorbing. Once entered, there is no return. End-stage organ failure is a canonical example. When a patient enters an absorbing state, the population average becomes irrelevant to their outcome. The law of large numbers requires a surviving process. It does not guarantee one. When clinical outcomes have heavy tails, severe events are not negligible. The law of large numbers may still hold for the population mean, but individual patient trajectories remain exposed to extreme deteriorations that the average conceals. Individual risk does not shrink with cohort size when tail weight is heavy. The law of large numbers addresses cohort-level behavior. It does not govern what happens to a single patient over time. This separation is not a statistical artifact. It is the reason ergodicity cannot be assumed in clinical outcomes. The population statistics are correct. They simply do not apply to the question of individual patient survival.